All right, all right. Well, we're going to be talking today about abortion in cows. We're talking about large ruminants today. So, nothing unusual. Usually, abortion at 1% of the herd. That's kind of like what is expected within the normal limits. But of course, if we're seeing something going over 1%, that's when we're trying to investigate and see what's going on, right? As we know, in abortion cases, typically if they start going over 5% of the rate, that's when we're like, we need to take a look over there and see what's going on. But there's always a gap in between, and it depends on the practice, it depends on the expectancies of the owners too. So basically, as we know before, with abortion, we can have some issues with reabsorption, a little bit of vaginal discharge, or return to estrus. So those are kind of things that we have to always keep in mind just to be sure that there's nothing else going on. So, for example, we're talking about different stages of abortion. We're going to start first with early abortion. So, early abortion, we're talking anywhere between the 3 months post fecundation. So we're talking about like trichomonas, for example. Sometimes we can have like different environmental factors. Sometimes we can have Campylobacter venerealis, which is another possible cause of abortion or early abortion. And then we also have like BBD or IBR, which those guys it could be anytime. If we're talking anywhere like a midterm abortion, which is on the 6 months range, we're talking anything like, for example, foothill, something that is being pretty sick on the west, California, for example. They had the patohuelos tick, the deer tick, just finding rather the chaparrals. And for example, IBR, as we said before, it could be anytime, so that's included here as well. BBD is included here as well because it could be anytime. 6 months, also we have chlamydia and sarcocystis, which is another possibility as well. And then late abortion, just almost full term, we can talk about a little bit about neospora. Be careful with those dogs on the farm. We don't want to have any dogs on the farm because they are pretty much horizontal transmission with neospora, so we'll always keep an eye on that. And then for other part, we can have a leptospira, which is pretty bad bacteria, as we know. And the only way to prevent it is just vaccinating our cows, but of course, we have to do it prior this gestation. And brucellosis is another one. Any type of toxins with like nitrates, and of course, if you want to end in inducing abortion or you want to do it, you can always use dexamethasone and prostaglandin for late-term abortion in case you decided to go that route for any reason. So testings we're going to be doing for abortion, basically BBD. We have a PCR test available just to be sure that that's not happening in our herd. Neospora, we can look for titers. Remember, Neospora is the late-term abortion. And then we have Trichomona, which can do like a little bit of proportional culture of the smegma of the male to be sure he's not carrying the tricks, the Trichomona. And then the Campylobacter, we're seeing cervical mucus. We can also send that one for culture. Leptospira, of course, serology as usual. Brucellosis, we can do serology. And foothill abortion, that one for the patohuelos, we have a PCR, which is a great thing that we have the PCR available. So prevention. Vaccinate with Leptospira, pretty important. Vaccinate with Campylobacter. Test your bull for any kind of trichomonas. Vaccinate for your IVR and your BBD. And yes, and as I said before, just try to investigate and be sure that this farm is not having a large number of abortions. If it is, we need to find out. We already talked about this, divided in 3 areas: early, midterm, and late abortion, and based on that, try to investigate more and see exactly what's going on. Thank you. All right, talk about bacteria over here, and we have actinobacillosis and actinomycosis. Basically, actinobacillosis is soft tissues getting harder, and actinomycosis is the hard tissues getting softer. Remember that, pretty well known. So typically happen on at the old cow. Most of the time, because their exposure with this kind of like coarse feet, scabrous feet, basically kind of rough, not rough feet to be like able to chew it up. In actinobacillosis, actually, the one that I have, your soft tissue is getting harder, is called wooden tongue. And that makes a lot of sense, right? Because your tongue is pretty flexible, the cow tongue is pretty flexible, and then suddenly having this bacteria making it harder, and make it like a wood, it's a wooden tongue, like a piece of wood now. So that's actinobacillosis. And then actinomycosis is hard tissues getting softer. So in this case, for example, lumpy jaw, that will be the name of, or more common name for that one. So actinobacillosis have been related previously with things like tooth extraction. If they needed to remove it, could be a source of that. So be aware of that. But as we said before, with actinobacillosis, wooden tongue, we're going to be seeing a little bit of pitulism, excessive drooling, right? Which is pretty common because if your tongue is all getting harder and it's all inflamed, going for inflammatory process, certainly it's going to be like drooly. The tongue is going to be protruding out of the mouth. Of course, there's going to be dysphagia because, since the patient is not going to be able to have the normal flexibility, it's going to be in a stage where it's all swollen. It's going to be all dysphagic. And then we're going to have a characteristic presentation of sulfur granules, which is kind of like a little bit of dry exudate, right? For example, chondroids on the girdle pouch are something that we see pretty commonly on horses, but in cows we're seeing kind of like granules in there. So we have to be careful with those kind of things. For example, for lumpy jaw, which is the other situation with actinomycosis, what we're seeing is pretty much a gradual onset on this one because this is a harder tissue getting softer. That's the other way, right? So the onset is going to be more gradual, and basically it's going to be like masses of the facial bones getting a little more like softer. So some of those teeth on the arcade, they can be like softer as well, any of the molars. And then we're going to have a lot of like edema, pitting edema under the ventral part of the neck. It's going to be a lot of ventral edema. So I have to be pretty careful with those. Best thing for both of them is usually use any good cleaning disinfectant for both of them. Anything that is related with bleach, it will be perfect to clean every area and kill everything pretty much. Differential diagnostics, basically, we can do lymphosarcoma, hemangiosarcoma, osteogenic sarcoma, foreign body, like a wire, magnet, selenium bolus, rabies because of the dysphagia and the pitulism, of course, listeriosis, botulism, or any kind of fracture as well. So there's a pretty wide range of differential diagnosis in between those two guys, but of course it has to be according to exactly what we're seeing, right? Treatment, our most important treatment is going to be sodium iodine, 2 weeks apart, sodium iodine. And we can repeat this 3 times. It is pretty caustic, so typically we recommend to use an IV catheter in order to place it in. 14 gauge is a cow, it's a pretty large animal. So be sure the cow is not pregnant in order to do this, okay? If she ends up being pregnant, you're going to have to use your Penji, which will be the other thing. But preferred treatment is always sodium iodine, as long as the cow is not pregnant. If it is pregnant, then we're going to have to use Penji. But just keep in mind that because that's pretty important in order to prevent any abortion. Other than that, just clean everything with bleach, as we said before. Anything that you're sharing between cows, any like speculums, things to look in the mouth, any utensils, because nose stones, things like that, we don't want any transmission. Thank you. All right, as we talked before, a few minutes ago, beside we talk about one of the causes of abortion. Anytime on gestation, it'll be BVD. So BVD, we're going to talk more in depth about this. As we said before, abortion any stage. One of the main causes of this virus is going to be cerebral hypoplasia, causing on the cough. So something that we have to keep in mind because that's pretty important. And also, in some cases, we can have even microphthalmia, which could be pretty dramatic. You'll see it. Um, we have a lot of many of defects on the cows as well that we can have out of this virus. So keep in mind those congenital defects that we're seeing in the calves. And this condition, microphthalmia, could be when they're like 150 days also. Just keep an eye. So talking about clinical signs, we're going to be seeing a little bit of epistaxis with BBD. It can happen with this virus, bleeding. And we can have ulcers on the mouth, mucosal lesions, they're horrible. We can have papules all over the body. The patient could be tachypnea, and we can have petechia, as we said before, all over the body. We can have diarrhea. Sometimes it could be a bloody diarrhea. So that's something that we have to keep in mind for sure. As we know before, the virus is divided into subdivisions, the type 1 and type 2, and both of them, they can have cytopathic and non-cytopathic. So the difference is like the non-cytopathic is going to be pretty much a persistent thing. So this clinical normal cow is going to be shedding this virus all over the environment and contaminating another healthy cows. And unfortunately, just continue replicating and replicating and replicating. Now, the problem with this virus is the virus itself, it has recombination on their RNA. So their DNA can be recombined at the time that they want it, whenever they decide it. And they can become to being non-cytopathic to a cytopathic virus, and it can be like aggressive, pretty aggressive at any moment. You don't know when it's gonna happen. So on the type 1 is the most seen, the most common. But as we said before, it could be a natural reservoir. It's going to be shedding for life. And even you do blood work, you do your serum, and it comes no antibodies. Like that, nothing, no antibodies. So it could be worse if the infection is acquired anywhere between 40 to 120 days of life. Because when you are a calf, that you only have like a 1 month age to about like 3 months age, 4 months, your immune system is not that mature that you can acquire, and then you can be persistent for life. So another thing that forgot to mention on the clinical signs is laminitis. That's another thing that we can see with these guys too. And the type 2, as we said before, can also have cytopathic and non-cytopathic. As we said before, non-cytopathic is going to be persistent. And you see on this type, on the second one, most of the time, mucosal lesions, often diarrhea, and also thrombocytopenia. So it looks like the type 2 is more aggressive compared with the type 1. But as we said before, either of those, it can change any moment. So differential diagnostic with this type of virus, beside abortion, the diarrhea, and everything else, of course, considering all these things, salmonella, copper toxicity, jaundice, parasites, IBR, pretty classic. So report to the state vet because it's kind of like a rinderpest, pretty much. So keep it in mind. But mostly of these cows, once they come out positive, the best thing is just to cool them. The ones that are coming are already sick on the type 2, that they're showing all the clinical signs like vomiting, I'm sorry, not vomiting. I'm talking about diarrhea, and talking about petechias, and those guys usually end in dying. But the ones that are persistent, if we have a good way to test it, which we're going to talk in a second about the ear notch test, we have to cool them. It's the best thing. Just get it out there, get out of the problem, so you don't contaminate your other healthy cows. So testing for BBD, we're going to be doing the ear notch test. So we're going to grab a little piece of the ear. We're going to take it out. I'm going to send them for pathology, and the pathology is going to confirm it if it is right there. Prevention, close herd, pretty much. If it comes positive on the test, out. Euthanize the cow, cool it, and we're gonna keep just a close herd. We're going to be vaccinating, which is a main prevention, annually. Modified live virus, of course, do it before you're breeding because certainly you're going to be having issues with abortions. So keep an eye on that because it's a modified live virus, so you'll make an abort right away. All right, well, let's keep an eye on that and let us know. We'll see you on the next. All right, next topic is going to be bovine respiratory disease complex. Basically, we're seeing this pretty much on calf, wing calf, anywhere between 150 to 800 pounds. Typically, we're going to see like all respiratory signs, like a flare, opening the nostrils, mucopurulate discharge. We can have a thin body. Patient is going to be dyspneic. Patient could be subcapnic. So all the respiratory issues, right? Whistles, we can have crackles, we can have perfusion. So the bovine respiratory disease really involves many, many things. It's not only just one thing in particular, but I want to tell you the most important box over here. It will be Pastorella. Pastorella takes a big thing out of this bovine respiratory disease complex. So always keep it in mind. I think now it's called Mahemian hemolyticus or something. Yeah, Mahemian hemolyticus, but it used to be called Pastorella. It used to be called also chippen fever or encephalic pneumonia. It's another type of the name. Just changing the name. Always changing the name. So differential diagnostic for this type of disease, we're seeing a typical pneumonia, any kind of pneumonia affecting, pneumothorax, of course, pericarditis, bovine viral respiratory disease. We'll always check your lower quadrant, behavioral just to be sure that we don't have any signs of pneumonia going over there when you're doing your physical exam on your cow. Treatment usually for these guys, we can go with strong antibiotics, powerful antibiotics. We can use things like a Cetiofur. We can use things like oxytetracycline, which is more affordable. We can use Nuflux, which is more expensive. Rofloxacin is going to be expensive too, but typically you cannot use rofloxacin in a dairy farm. So it's only for a beef farm. Because the withdrawal time, of course, considering that as well. But in a dairy farm, it's going to be prohibited pretty much because the transmission to humans. And of course, you can still using penicillins as well. But those are your choices. You need to know what you are not able to use on these guys. Okay, and one of those things is going to be chloramphenicol. It's a no. Nitromethazole, forget it. Vancomycin, worst. Bute, forget it. Clenbuterol, no way. Sulfamethoxam, at all. And no cephalosporins as well. So be assured of that because that's pretty important. Because that could be a bad thing if we're getting you those things and then later getting in trouble. But it's high mortality with this disease, unfortunately, because of the dyspnea. The sooner that you start treating it, the sooner the patient is going to get better. So be aware of that. But yes, unfortunately, there's no vaccine for Mahemia hemolytica yet. So just keep an eye on that, and as soon as you cut it, you need to start treating it right away. So we'll prevent everything and give a lot of support to your patient. All right, next is gonna be calf diarrhea. Calf diarrhea is one of the main things that happen with these little ones, 2 to 10 days of age. So be aware of that. Pretty important because their immune system is pretty weak, and if they don't have a good colostrum and they're getting weak and E. coli is taking over, forget it. Same thing that happened with horses. So as we talked before in another lecture. So basically 2 to 10 days of age, it's pretty common. As I said before, E. coli is one of the main ones. Streptococcus, it will be the other one. Remember, E. coli, the enterocolic version. Salmonella can cause as well diarrhea, pretty bad too. One of the main things with a little calf is their extracellular fluid contains at least 60% of the total So we're seeing about like a patient that is gonna get dehydrated pretty quick. So just because the concentration of fluid out of those cells on the extravascular space. So in the intravascular space, I'm sorry. So keep an eye on that. So hyponatremic is a possibility. The patient is gonna get hyponatremic quickly because the loss of fluids. We're gonna develop metabolic alkalosis. Then our potassium is going to be high. Then we're going to be hypoglycemic, which is pretty common, like any other younger animal. Same thing when you have puppies or the parvovirus, when you are like at the ICU unit trying to help them out, and they're hypoglycemic, or any small breed in a dog or a small cat. It's the same thing. It's a small calf, just because it's a little larger, but doesn't mean anything. Still is a younger organism, so we need to help him. So typically we're going to see a lot of dehydration on these guys. It's going to be a quick dehydration, sunken eyes. Of course, we have to be considering their dehydration because we don't want them to get like pretty bad. Basically, dehydration is something that we had to estimate on these guys. So remember the formula for dehydration, right? Your patient's weight times the dehydration that we are facing. We talk about this in another lectures, 5%, 8%, 10%, right? Dehydration, high numbers, and all those percentage, we're getting it based on the physical assessment, right? And there's a way to check for skin turgor, check for mucous membrane. We can even do a little bit of blood work. We can check the heart. So keep in mind before to do your assessment. For example, we have a cow here that is about 50 kilograms, 110 pounds. We're estimating about 8% dehydration. So we're going about like a 4 liters of deficit just for the dehydration part. Certainly we have to give them this over a certain time. It's not going to be like immediately. And another thing that we had to do, we're usually 24 hours. Another thing that we had to do is we had to be sure the patient is getting sodium bicarbonate on the fluid. Because as we said before, the patient is getting hyponatremic. And at the same time, we're dealing with a metabolic acidosis. And if we don't correct that, that's going to be a problem. The patient is going to start perking up. So most of the time, these cows, they usually have like a low base deficit. The base deficit, you can estimate it, buying your one of those electrical analyzers like an iStat. But in reality, every machine costs, every cartridge costs, and everybody has the access for it. So you can also estimate the base deficit, which you typically estimate at 10. That's pretty much what we do in our hospital, estimate at 10. So, for example, if we have a patient that has a pH of 7.2, right, and my base deficit is going to be minus 10, so 10 is my base deficit, I'm going to multiply that one times 50 kilograms, right, and then times 0.6. The 0.6 comes from the extracellular fluids. Remember that we talked before, these guys, just because they're younger, typically it's about 60%, so 60% is, converted is 0.6. So that's going to make us a total of 300 milliequivalents of sodium bicarbonate. And remember, super important thing, it has to be isotonic sodium bicarbonate, okay? No straight out sodium bicarbonate that is not isotonic, because hypernatremia could be a bugger. So be careful with that. It could be a big bugger. So you don't want to have any trouble with that. So considering this, we're seeing pretty much that we're going to be dispensing all this amount in a 2-liter bag. And so basically we're going to use our first 2 liter for our dehydration and 2 liter for replacement of our bicarbonate. We can add some dextrose in there, another 50% in there. And so we can have like pretty much this deliver over 24 to 40 hours. Be sure that we'll still checking the colostrum on your cow, just to be sure that there's no deficit on colostrum. Otherwise, you're gonna have to be supplementing things like that. Sometimes we can supplement things by mouth. If the patient is able to suckle, we can start defrosting colostrum from another cow. If you feel like the colostrum in our cow is not really helping much because you measure it and it's below what we're expecting, do not do any microwave, because microwave kills the IgG, remember. So everything has to be taught just old-fashioned, always old-fashioned. We can give in electrolytes by mouth. We can give a meal replacement by mouth in order to start perking up this cow and start helping with these needs, because it's pretty important. So be aware of that. So that's pretty much for the situation. Remember, if the cow is a little older, also 10 days around, we can consider another causes of the diarrhea besides the E. coli enterogenic form and streptococci. We can also consider cryptococcus, which could be common as well. Giardia will be kind of weird, but it can happen sometimes. Or sometimes a little bit of a nutritional factor. If we have a pH on the stool, this is great. This is when we need to get one of those tools to measure the pH on your stool. But if not, you can use strip. If you have a pH that is below 7, remember, typically below 7, it's acidity form, and usually viruses. Viruses are involved in all the acid stuff. Corona, rotavirus, BBD, IBR. Those are kind of things that you have to keep an eye in there. So be aware of that. Now, if you have the economical means and you can get an iStat, that would be great, because that one also has pH, it has bicarbonate, CO2, and also the base deficit and glucose. So you can get one of those cartridges, the EC8. Those are pretty good. It has a CG4 that has all those metabolites in there, so you can look at it pretty quick. Hygiene is pretty important. Clean all the hutches, everything. Use quaternary ammonium, because remember, this kind of bugs, they can be passing from one to another one, and you don't want all these calves to start getting sick. So you already have one, you already have two, but you don't want all those hundreds that you have right there to getting sick. So you need to control it, separate it, clean it nicely, and use your quaternary ammonium and try to rehydrate this puppy as soon as possible. So you just keep it in mind. All right, well, I guess for now, this is all that we're going to be talking about, like calf diarrhea, and we're going to continue in a second. All right, so it's time to talk about clostridial diseases today. So we have clostridial diseases. So pretty much on Clostridial, we have so many, really, to be honest, so many. But well, anyway, we're going to mention a few of them. So we have the Clostridium novae type B, which we have the black leg disease with that one. We had the Chaboy, usually happening anywhere between 12 to 16 months. We had the novae type D, which is a hemolyticum, and that's the one that affecting hemolysis. We had the Perfringens, Chaboy, Septicum, Sordum. Those cause gang gangrene. Remember, Chaboy, Septicum, Sordum, gas gangrene, and Perfringens. All those four guys. And then we had the Perfringens, the D, that cause enterotoxemia. And then we had the Septicum, which cause necrosis fasciitis. And then the Perfringens type 1. And also the botulism. And the beta number 2 too. So there's so many, really. Perfringens D, remember D, imagine the D is a kidney, because letter D as a capital D almost looks like a kidney, right? So that's pretty much the way you have to remember that one. Botulism, as we talked before, it is, fine pretty much in dark, humid confinements, like silage, right? So be aware of your silage, your bale hay, your mix ratio. Be sure that we're not having any issues with that. And we have to be pretty proactive, be checking all these things on the ratio when we're mixing all this. So clinical signs that we're seeing on these guys, they go pretty different, really. For example, on the nobile, we have cyanosis, we can have sudden death, we can have black body fluids all over the body. That's the reason, because it's called black disease. For example, the Chaboy, It's about like 12 to 16 months old, right? That's the most common. Starting that, we got crepitus with chaboy, crepitus, muscle necrosis, lameness, a lot of crepitus under the muscle, a lot of gas in there building out. For the novi type D, same thing. We can have like problems with hemolyticon fluke in the river. It could be carrying it. Rapid death, icterus, hemoglobinuria, urinary blood, red water disease, all the name that you can find in the literature. And you have to be careful with the copper levels for sampling, so always keep an eye on that as well, just to be sure that there's no main theme. With Perfringes, Chaboy, Septicum, and Sordon, gas gangrene is another type of gangrene. It's different than the Chaboy, which is more crepitus under the muscle necrosis, but on this one it's more gas gangrene. It's pretty histiotoxic. It kills all the tissue cells, and we can have fever. We can have swallowing, gas, and acid odor. So keep an eye on that. That's pretty bad. Don't forget about your Clostridium tetanus, which is the most common one. Remember, anytime that we got like bit by something, bit by a cat or bit by a dog, or you have a nail on your foot, or something like that happen, they vaccinate you for tetanus. It's the same thing with a cow, right? So Clostridium tetani, usually all the neurological signs, flashing of the third eyelid, stiff gait, trismus, right? A little bit on the mandible. Trying to open the mandible, all swollen, stiff neck. We can have issues when we're doing any dehorning, any castration, any puncture. So be aware of that, because that's where Clostridium tetani likes to hide. He likes to hide on those things, and the dehorners, and the castration tools, or anything that causes any kind of puncture around the animal. So all those needs to be nice and clean and disinfected all the time. Yeah, and I guess one of the ones that I hate the most might be Perfringes, in my opinion, just because of the fact that it has sudden death and bloody colic, blackberry jams, feces. I really hate that one. It's one of the worst ones. So yeah, just keep an eye on all those things. Prevention, vaccinate. There's a 6-way vaccine available on the market, so you can do one at 3 months of age, then another one at 4 months of age, and another one 6 months of age. So during the first year, we're going to be doing like three of the polyvalent vaccine in other ways, or bacterine, I should call it, right? Because all these are bacteria. But and then finally annually after all. So keep an eye on the clostridial diseases, because they're everywhere, they're ubiquitous, and we don't want them to get sick. Thank you. All right, next disease we're going to be talking about today is going to be frothy bloat. This one basically, it is distension rumen, and it's going to be related with diet pretty much, right? Mostly more than diet, I would say pasture more than anything, and acclimatization. Those are the main two words on these guys. So so basically this kind of condition happens when we're introducing these cows to different type of pastures that contains a lot of clover or alfalfa. For usually slow introduction, they shouldn't have any problem. They can go like a little bit at a time, 2-3 hours, and then bring them back. But the problem is, like, if you let them sit over there and eat it all, that's when they start bloating. These guys usually, they're gonna be like having all this distension of the abdomen, because the grass is fermenting inside it. And what it happens is, like, it creates so much distension that it can start suffocating the animal. And it's a distension that not able to eructate, so they're not able to release those gases. And then the consequence of that one, it could be like either post a cable compression, and then can certainly like create a problem, because the cat is going to be all this thing and can die right there. And pretty much almost a pretty bad choke that is going on. So be aware of that. You can always pass a nasogastric tube just orogastric tube. Sorry, nasogastric is on the horse. Cow is orogastric. Orogastric tube. You can use your frick speculum. Kind of like go inside the mouth of the cow. You can just like get it on the trap. If you have a trap, put it in there. Put the head over there. Would you use your left hand, or you can tie the cow to the post and tie the head over there, and then you're gonna be pulling the tongue to one side. Of course, go into the interdental path, pull the tongue out, and then you're gonna feed the frit speculum. And once you have the frit speculum in, then you can start feeding your tube through it. Your assistant is gonna be feeding the tube. And once you get to the esophagus, you're gonna feel resistance. You're gonna start blowing in, just to be sure that there's nothing like obstructing the way. Because if you're blowing in and you can still blowing and blowing and blowing, you are not in the esophagus. You might be on the trachea, because that will be a situation with the cows. So you need to feel that resistance. And once you feel that resistance, they pass it in and just continue feeding it. And then finally you're gonna feel like it smells, like a rancid, which is coming from the rumen, and then certainly you're gonna be able to siphon some of that and take a look at the green pasture material that we're sealing. So do not to get there. So always keep an eye. Don't try to do the easy way. Some veterinarians are like, oh, I just can do a trocar and just can get everything out. Forget it. Trocar is not going to work. You're not going to make it worse. You're just going to get peritonitis in this cow, because it is too thick, it is too fruity that it's going to plug any trocar. So it's not going to work at all. So best thing is just like move the cow around. You can give it some salicylic surfactants, polyoxylene. Therabloat is a medical name, Therabloat, but is a trade name, sorry. Salicylic surfactant, that's a medication, and it help you to reduce this amount of fraud that we're seeing in these cows. So prevention, it will be gradually introduction to the grass. I would say like 2 to 4 hours daily for over a period of 2-3 weeks. And then finally they're going to get better after all, and they're going to get used to the grass, and they can eat longer time with no problem. But here the thing is, like some cows, they don't have that many of those receptors in order to degrade this chloroplastus, which comes out of the grass, and then that's the problem, right? When we're seeing this diagnosis, differential diagnosis on these guys, choke, of course, because what we're seeing, rabies because of the mouth being like drooling. Typically, I don't know if you have dysphonia on these guys, but I don't think so. But vagal indigestion could be another thing, because the extension of the abdomen, and ascites, of course, because of the extension. So everything happened because parotid gland, the parotid glands, they don't have the anti-frothy cells, and some of them they have more, some of them have less. But either way, the best thing is just to prevent offering a small amount until they get used to it. So keep an eye on that, and just don't let it eat by itself. If you have so much clover or alfalfa on your field, mostly green legumes. All right, next topic that we have today, and we're going to be talking, is about hypocalcemia. So certainly on hypocalcemia, we also call it as a milk fever or parturiente paresis. It's the same name pretty much. It's just like different type of nomenclatures. So happening on multiparous cow. Multiparous cow is having many calves before in her cow life. So classic is gonna be the cow is gonna be sitting. It's gonna be all down right there, no moving. And usually can happen like a week prior calving, or a week after delivering, right, of calving. So either a week prior or a week after. So basically low calcium, right? One of the things that we're going to be seeing is slow menace response. You can see it over there. It's going to be in the face. The heart rate is going to be pounding. It's going to go up. We can see these cases It happens a lot also in the small dogs. I don't know if you worked previously with Chihuahuas when they are giving birth after a litter of 3, 5, and then suddenly they show to the emergency hospital with high temperature, high heart rate, trembling, shaking. Um, so it's the same thing, no? Eclampsia in a Chihuahua, hypocalcemia in a cow. So hypothermic cow is going to be also a pneumonic thing with these guys. And we're going to check the rumen. We're going to the left side, paralumbar fossa, rumen atony. There's going to be nothing. Trembling, like a little chihuahua. Ileus, everything is paralyzed inside. And also the belly is going to feel all flaccid. Extremities are going to be all cold. So keep an eye on all those things because it can happen. Having a large cow is not that easy. So be aware of that. So always manage your cows properly with a proper diet, mostly after surgery, because the milk production and the delivery is so much to go for these poor animals. So differential diagnosis, we're going to be talking about toxic mastitis, hypokalemia, hypophosphatemia, skeletal injury, because the paralysis, rabies once again because of the trembling. We can also have grass tetany. So that's kind of like the most known. And when we're doing a little bit of testing, we're going to be checking our calcium. As we said before, in emergency occasions for small animals, always use ionized calcium. Total calcium is helpful, but it just gives you a total. Ionized is the best. That's what's ready for consumption right there. So if we start seeing anything less than 8, getting concerned. 4. Typically, the less than 8 on the total calcium is going to be like 4 in ionized calcium. So be aware of that. We're kind of halfway on the. Check your electrolytes, your phosphorus, magnesium, and potassium as well to replace them if we're seeing any deficiency of those. So treatment, if we're at stage 1 where we can still handle it, but it's like mild symptoms, we can try attempting treatment by mouth. Oral gel, there's a gel calcium 100 milligrams every 24 hours. So that's the first one. Or if we're at that stage the patient is completely immobile, just sitting down, we can start with our injection, always calcium, borogluconate IV. Borogluconate IV. Of course, dissolve it. Of course, we have to give it straight out, but we go carefully when we're doing this. And about like 12 grams probably IV. And to be careful when you're giving it, just be sure there's no tachypnea, any rapid pulses. If you start seeing anything like that, you have to stop the calcium. There's no way to put an ECG like when you're doing it in a small dog, but you can do it slow. As long as you do it slow, probably you'll be all right. If you get too quick, that's when things happen. But if you start noticing rapid breathing or rapid pulses, then you have to stop the calcium and let it have a break and then retry it again, but it's in a slow manner. And then, of course, we start supplementing calcium and the compounding diet so we can give it extra support. But yeah, basically it's just a type of disease that is expected after, calving and being a cow that is being exploded, getting her milk and everything. So people who drink milk are like having so many issues, really. But anyway, unfortunately, that's the way of war it is. People drink milk every day. All right, next talk today is going to be jaundice or paratuberculosis or MAP, which is a mycobacterium, paratuberculosis. So many names, really. Jaundice or crumbs in humans. They think like it's related with crumbs in humans. The only thing that I can tell you with this disease, basically, this is just finding the tip of the iceberg in your practice. If you're only finding this, it's for some reason, and then you're going to have to investigate more. So typically, we're going to see a cow that is pretty thin. Body condition is going to be poor. And ribs are going to be pretty visible. So be aware of that. Lymph nodes are going to be swollen. You need to check the lymph nodes. Prefemoral are pretty important. Reproduction rate is going to be low. In this guy, you're going to be inseminating, you don't get it, nothing. Diarrhea, thin body. So yeah, there's a lot of implications really. Even epitaxis could be in some of these cases when the liver is affected. Lameness is another thing that we can see on these cows. So the main thing with Johnny's is it is a reportable disease. Super reportable. You don't want to lose your license, you need to report it. Remember that. So one of those things that is important is like there's no treatment for this type of disease. So the most important part is first of all to diagnose it and then to cool it. That's pretty much it, unfortunately, because we don't know for sure if this is like 100% zoonotic or not, but at least there's some researches where they're saying the Crohn's disease, which is kind of like the IBD in a dog, right? But in human version, it is related to the Mycobacterium paratuberculosis. So there's a possibility that something like that is happening. It's not being 100% proof, but it's something that it needs to be cooled. Milk production is going to be horrible, pretty bad milk production. So differential diagnosis, just because of the thin body condition, parasites for sure, Cooper deficiency because of the thin hair. We can even think post-cable thrombosis, protein loose enteropathy, congestive heart failure. We can have pyelonephritis. So those are our differential diagnosis with this disease. So the way we're going to be checking here is pretty much a ELISA test. There's ELISA in the market for Johnny's. So get your blood, get it out. You can do a fecal as well. Comes positive, cool it. Fecal culture comes positive, cool it. So it is very important to keep an eye on those. Milk, blood, feces, soil can live up to 18 months on the soil with no problem on the fecal material. So yes, the best thing is just to get rid of the cow and just like a clean environment. That's the only thing that you can prevent to have more of these issues in your farm. So remember, possible cyanotic, but it's not declared. But pretty much as a chronic condition that is just causing more problems in your practice. All right, next disease that we're going to be seeing today, it is lymphosarcoma. And basically, I'm going to tell you, this Delta virus, lymphosarcoma is a Delta virus, they are pretty spectacular, really. Things that they cause is like horrible. I've seen cases where I've seen this proptosis keratitis happening overnight. I'm surprised, really. The next day is like the eyes are almost protruding out. It's horrible. So persistent lymphocytosis is something that can happen with this. It's an unknown, but it happens. Lymphosarcoma can get on the central nervous system, so that's a possibility. And get on the lymph nodes. Check your submandibulars. It can get on the thymus inside your cow. It can get on myocardium. It can get on the abomasal. It can get in the uterus. It can get in the other. There's other sarcomas as well. It can get on the mammary lymph nodes or supramammary lymph nodes too. So it could be everywhere really. So be aware of that. The way to diagnose this is basically biopsy. We can also do serology. There's the BLV GP51 antibody, or there's a PIP24 antibody as well. But biopsy will be the best one, in my opinion. But you can still do serology. So as we said before, you have to keep an eye a lot on the vectors. Blood vectors usually can be insects, one of those too. So unfortunately, with this type of diseases, be such a metastatic disease, in other words, call it like that. There's no treatment. The only thing is just to cool the cow and burn the carcass. That's pretty much it. So not even to think about consumption, doing anything with her, with the meat. So unfortunately, it's like that. Differential diagnostics for bovine lymphosarcoma, we have Uh, Based on the location, because as we talked before, we can have it on the lymph nodes, on the thymus, on the mastoid, on the uterus, myocardium, other. So on the CNS, we have in the CNS, they're going to have like a neurological. So based on location, you can use differentials. There's many. Vagal indigestion is one of those. Lymph node access, abscesses, mastitis, spinal injury, ibomesal ulceration, indigestion. There's so many. So it's not considered zoonotic, but the cow is not eatable. Remember, these cows are not eatable at all. Okay? So early in life, they're going to be for life cheddar. So keep an eye on those. But we start seeing that they're coming positive, either your serology or your biopsies. Then consider and start cooling these cows and then send it out, because you don't want this to be spreading in your farm. So everything is going to be disinfection, disinfection, disinfection. That's pretty much the key to finish with this type of viruses. All right, next disease we're going to be talking today is Listeria monozygotis. Remember that? So usually happen anytime between when they're weaned to be an adult. It is brain disease, usually cause a lot of neurological signs. You can see the patient start like circling a little bit, mostly related with spoiled silage. Remember, that's important. We talked about this in the previous lecture about like Clostridium, getting on the silage. The same thing with this guy with Listeria. It happens typically when the pH on the silage is over 7.4. So unfortunately, no, we'll have time to check the silage pH, but something that it is. And usually we're seeing unilateral neurological signs. Unfortunately, there's a sudden onset of death on this one. And there's sudden onset of neurological signs are showing up. So something that can happen. So as we said before, head tilt is going to be one of those. It's kind of like half of your body. You're gonna have also to skip the milk. So this type of milk is not gonna be good to be consumed for humans. So most of the signs are gonna be sensorial signs, depression. You're gonna be losing pretty much function on cranial nerve 5, 7, 8, and 10. All the cranial nerves are gonna go down the hill. And facial paralysis, in other words, jaw drop. Circling, either CP deficits. That's something that you're going to be seeing. Unfortunately, there's not really a standard test for this type of things. So that's something that is like sitting right there, and you're going to have to work basically on your symptoms, right? What you're seeing. So we have differential diagnosis with listeriosis, anything that causes, same thing. Any cause like neurological signs, rabies, for example, polio. And we're talking about polyencephalomalacia, right? Which we'll talk in a little bit. Remember, thiamine is a big thing with those. Then we have lead toxicity, of course. On thrombomeningoencephalitis, this could be another possible as well. So keep an eye on those things. If we're doing treatment, we're seeing all these neurological signs. Tetracyclines is going to be number one. PENG, start treatment right away. You need to treat it okay in order to make it eatable again or make it drinkable again. So treat it with your PENG and tetracycline. Be sure it's completely clear, and then you can go back to production. But yeah, it can happen. Abortions can happen as well with Listeria. So remember, we talked about this previously. It is on the list of abortions too. So keep an eye with this. But this is susceptible to antibiotics, but it really depends how bad those clinical signs are going to be manifesting or not. All right, now we're going to talk about metritis, pyometria, and retained placenta. So that's pretty much three things that are common in the cow. So speaking about metritis, usually happening anywhere between 3 days, 2 days postpartum. Any infection on the uterus, it's kind of like the expected time. You're going to do your palpation on rectum, get your sleeve, get a little bit of lube, remove a little bit of feces and try to get in and try to find out what's going on. You're going to see the discharge is going to be purulent and malodor Oh, smells horrible. Metritis is horrible, really smell. But well, anyway. Pyometra, typically you're not going to see any estrus and the cervix is going to be closed, but can happen as well. Retained placenta, of course, no passing the placenta for more than 12 hours. That's what we consider retained. In cows, in horses, some veterinarians 3 hours, some they say 6. It's up to them. Some they say 4, but somewhere over there. So make your own judgment, depending what you're seeing, of course. So with metritis, typically we can start treating it with a little bit of prostaglandins, just to start moving things out. In antibiotics, preferable PNG or tetracycline. Remember, tetracycline is one of the big ones because that's the one that works on present or post. That's the word that can work in any kind of infectious processes. Remember, some antibiotics, they don't have coverage when you have an infection process, but tetracycline is one of the best ones. I'll tell you that by heart because I even use it on cats. Of course, diluted and given Sucure, right? But because it stinks like hell in cats. But a cow can stand it with no problem. Anyway, I'll use it in Pyometra in cats, but diluted with saline and, of course, given in a large amount. And usually for feral cats, they were just like in a homeless situation. But it works perfectly. It works beautiful. It dries completely the whole uterus, dries everything out. All right. Pyometra, you can do an ultrasound for detection of the corpus luteum. See if there's something going over there. On the metritis, we have a good prognosis. As long as we're giving the good antibiotics and the treatment is fine, which should be fine. Pyometra, unfortunately, we had to cool them because this is something that's going to be happening and happening and happening. So, and the rate of fecunding again is going to be pretty low. The rate of reproduction is going to be low. So, keeping an eye on that. Don't forget the cows, they have epithelial chorial placentomes, okay? Remember that's pretty important. Epithelial chorial placentum. That's an navle question. Remember that. Very important. Comes on the navle. So for retained placenta, we're going to have to check hypocalcemia. We have to be sure that we're checking things like for prevention, right? For prevention, I would say for prevention, hypocalcemia. We can also start it on ionized salt intake. We can give it vitamin E and selenium. We can be overcrowding and avoid the cows, and also try to cool all the obese cows. That's pretty important as well, because those kind of things can happen too. All right, let's keep an eye on those things, and we'll be back on the next talk. All right, we're back in the track. So we're here today with mastitis. So mastitis, all breeds, all ages, be aware of that. It happens a lot on dairy cows. Yearling heifers usually are the ones that they are like most known for this. So it depends what kind of bug is affecting, because it could be pretty chronic. If it is a strep, usually they respond pretty well, and they do well after all. If it is a staph, no, it's not going to be of that, because usually it is pretty variable results with staph, and also we're going to be ending cooling them just because of that. So keep an eye on those things. So remember, things that we can see on mastitis is basically coliforms and acute forms, staphylococcus, diarrhea, high mortality, toxic or septic. So that's something that is going over there all the time. That's pretty much kind of like the acute presentation. On a chronic presentation, we're going to have like a swollen ferns udders. And of course, we're doing our California mastitis test all the time to check and see our somatic cell count. And of course, it's going to show us that it's pretty high. So be aware of that. There's vaccine available, but not everybody vaccines really, because it's kind of controversial vaccine. But it is in the market. It's the EJ5 E. coli. And as I said before, it will just depend, what kind of strain or what kind of thing your cow is going to be getting. So clinical presentation, the milk production is going to be from the floor. It's going to be low. Lymph nodes, it could be enlarged. Basically, the ones that are around the area, the prefemoral. It's going to be firm, hot, and painful, of course, as we talked before. And there's not really many treatments to control mastitis. The best thing that we always recommend is basically disinfection and cleaning. But there's intramammary formulas, for example, that are based on penicillin and streptomycin. We can use it in. And we always recommend to disinfect teats like at 30 seconds at least, and 3 to 5 days on the road in order to start helping out with a little bit. So the problem with mastitis, as we talked before, is direct transmission on the milking line, and carrying all these bugs, like Streptococcus agalacti or Streptococcus dysgalacti, Mycoplasma bovis, Staphylococcus aureus. So carrying all these bugs with you is like so much, really. So California mastitis test, as we talked before, anything like over 200,000 we start having issues. So keep an eye on those. Acceptable range, it could be like up to 200, 300, I would say the most, depending on the production. But over this moment, over these numbers, is like always just suspicious of high mastitis going on in there. So be aware of that. You can use your California mastitis test as we saw before. Some people use them facing the tail with the end of the plate, or you can use it the other way towards the head. The other way, either way is fine. So prevention, just check the mammary glands for any type of pressure, increasing on temperature, possible signs of infection. Use your iodine. Ask your people, whoever's working, to have a good hygiene, nothing dirty, and just pre-dip, pre-dip your teeth pretty much, and have a pretty nice bedding too, because whatever they're going to be laying down, that's pretty much where they're going to be picking up things. So if you don't have a good environment for your cow, you might be carrying all this mastitis just because of you being neglected to your cow. So keep an eye on the environment too. We want to have a clean and nice bedding, and we don't want any kind of bedding that is containing E. coli or streptococci or staphylococci. All right, next topic today is going to be omphalitis, meningitis, and naval septicemia. All of them is kind of like the same thing. Attributed to what? Failure of passage transfer. That's the only reason. If you have a cow that it has a calf and you have a good colostrum, you're not going to have any problem. If you have a cow that is not producing good colostrum, it's a stress. The calf is not getting good management, good colostrum, good suckling, is having issues, you're going to have problems. So omphalitis, as we know, umbilicals, painful. We can have issues over there. We can have urachal obstruction, or we can have a fever. So just check your racus. Meningitis, cases where we can be like opisthotonous, which have exaggerated hypermetric gait, and hyperesthetics as well. Naval, pretty much joint ill, right? And septicemia, well, as we talked before, failure of passage transfer. I would say failure of passage transfer for all of them. So clinical signs, it can be different, as we said before, because all these situations, meningitis, of course, affecting the brain, omphalitis affecting the area. We can have plus minus patient uricus. When you have the joints, right, on navel oil, we have joints, articulations. All of them that are going to be like pretty painful. Joints, periarticular swelling, a little bit of joint swelling, so be aware of that. And we have pretty bad colostrum, and it's giving us a patient who's been septicemic. Then we're going to be like having diarrhea as well when you have a failure of passage transfer. So be aware of those things. It's usually like so much stuff. So let's talk about a little bit of treatments. For example, for meningitis, we can start treating with antibiotics and giving a little bit of diazepam to control the neurological signs. Something that you can do for sure. If we have a failure of passage transfer, we need to look at our colostrum, get a little bit of colostrum, put it in the refractometer, check the specific gravity. Is it over like 1050? Should be good. If not, we can start supplementing colostrum 500 grams per gallon. At least we need to give him 4 liters to this calf by 2 hours. 2 hours each. So if they just was born, they need to get colostrum. Pretty important. And if we are then doing serology on one of these calf, we can use refractometer, and we just have to be sure that a 24-hour of birth, so 1 day in life in this planet, should be like around 5.5 grams or above that. It will be 6, perfect. 6.5, even better. But if it's like 4 or 3, we need to start filling this calf with colostrum. Pretty important. So basically, for antibiotic treatment for that conditions in general, for the joint disease, we recommend antibiotics, Nuflor, Naxil, Timentin. Those are the most common ones that you can use in cows with no problem. We can flush the joint. We can give it a little bit of pain medication also in situ. We can flush and actually put some morphine in there with a little bit of saline and ampicillin and just put it in the same flushing. So be aware of that. Ophalitis cases, if we have a urethus in there, we have to fill the urethral stalk, give it antibiotics, surgical resection of the urethral stalk. If he has a hernia, check out, palpate it, do an ultrasound, find out if it's a true hernia. So be aware of that because that's pretty important. So differential diagnosis for, for example, meningitis, we can have any kind of like cerebral disease, like a polio, once again, poliomencephalomalacia, which is thiamine related, cerebral hypoplasia, which we talked in the previous talk about BVD. Remember, cerebral hypoplasia, and also small eyes, right? To pretty tiny eyeballs. And also neosporosis, transmissible by dogs, as we talked before, or hydrocephalus. Remember that prohibits drugs, that's pretty important, and mostly on cows. Nitrofurazone is a no-no. Lincomycin is a no-no. Chloramphenicol is a no-no. We're not using any of those because those are pretty dangerous. You don't want to jeopardize your license and get your license out of the state because of that. So keep an eye on those things. All right, we'll see you in the next talk. Thank you. All right, it's time to talk about polio. Polioencephalomalacia. Usually seen patients over 2 years old. So basically, we're not going to have any timing on the rumen. Remember, soybeans kill timing. They have timing issues in there, right? So be careful of soybean diet. Basically, we're going to see a little bit of central nervous system sign. We're going to be seeing head pressing. Blindness is a big thing with the normal PLR. Stargazing attitude, pressing the head. So be aware of that. Some of the legs are going to be like coming out like hypermetric just because stargazing. So kind of common to see that. Differential diagnostic with this disease is going to be like rabies, of course, because of the blindness and the attitude, stargazing attitude. We're going to have difference with lead poisoning, salt poisoning as well, something that feeds the CNS, getting all hypernatremic, trauma, nervous coccidiosis, that's another one, that's a big one that we should be keeping in mind as well. And so be aware of these situations. My best advice is no matter what you're seeing, patient is blind, patient is stargazing, the patient has a head pressing attitude. As long as you're not considering this to be rabies, give him timing. All these cases, CNS sign, give him timing. Nothing is going to happen if you give him timing. The only thing you're going to do is just losing the dose if it's not, right? But for most of these diseases, timing is the solution. Subcutaneously or IM, I will give it IM. I will never give it IB. IB, it's a trouble because typically can cause a pretty bad reaction, anaphylactic reaction. So always IN or IB in the muscle. Remember that. So when you're doing a grain introduction, just do it slowly over 14 days old, because also same thing. As we said before, soybean can kill the timings. So be sure that there's not much sulfur going over there, because if you start smelling that one like a rotting egg, and the rumen starts smelling like that, something could be going on affecting the timing assets, killing the timing. So just keep an eye on polio, but pretty easy to fix. Timing. All right, it's time to talk about the right displays ablumeson and left displays ablumeson. So right displays ablumeson, we're talking about like 60% of the cases. Left displays ablumeson is more common than that. Much common than the right one. So it is a female cow disease happening 1 month pre or 1 month postpartum. Same thing that we talked before, right? With the hypocalcemia, like because of the excess use of the cow. The same thing. This just happened because the cow just got a parturition and they got excess of space in there, so things are pushing all over here. It is important to be sure that we're not seeing any ketosis along with this because they can have like pica episodes, so be aware of that. So, clinical signs, acetonemia, anorexia, and weight loss. Those are the big ones. Sometimes you can have a scant stool. And of course, the main things here is going to be the pinning of the cows, right? For example, when we're checking the pins, we can see that there's a high pitch pin, and they're usually, on the pretty much area that goes from the olecranon all the way to the beginning of the perolumbar fossa. You can go on the perolumbar fossa and you can have rumen pins, but my margins for abomasum, it'll be like going from the olecranon up to the last rib when the rumen is gonna begin. Stop right there to all the way to the olecranon, and you're gonna check your pin over there. So it's gonna sound like a pretty high pitch. Someone described this like when you're kicking a can in the alley, click, and sound like ping 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 ping. So something like that. Pretty high pitch. So be aware of that. But it can happen. It can happen. So typically left side of the cow, as we said before, display abomasum. So go olecranon all the way to the beginning of perolumbar fossa, and the right one is going to be on the low side on the 6 intercostal space. Pretty much we're going to find it. And if you find it on the right one, it's going to be like a volubus in there. The problem with the right one is typically alkalosis and hyperchloridemia, and that's because pretty much the chloride is sequestered, right? And that's the reason because we have this dearrangement with electrolytes. So treatments, basically on the left side, we can try to do the rolling technique only for the left one if it is diagnosed on the left one, and see if it works. It's not an easy thing to roll a cow, but it's a possible that we can try. On the right one, forget it. Right one is gonna need surgery. And on the left one, as I said before, we can do rolling on the toggle technique just to attach it. Can pass this wire inside and just keep it in place. And the left one, we have to do the surgery, the omentopexy, just to put it back on the ribs, and there's not having it hanging right there. So be aware that 0.1% of the displays abomasum can happen annually. Be sure that we have good amount of intake of dry matter, and limit the corn silage. We don't want to eat too much corn silage that can cause this type of fermentation. Fermentation on corn silage is big, remember. And always check your silage. Be sure it's not dirty because we don't want any listeria or any kind of clostridium getting in there, right? Or botulism in there. So keep an eye on those. So you know that. Left one, the most common. Right one needs surgery. Left one, you can pin it. Trash can in the alley. The sound is going to high pitch. On the left one, we're going to be finding on the 6 intercostal space. On the right one, sorry. And then we're going to get a bolus alkalosis, hyperchloremia. So be aware that we're going to need surgery to repair that one. That's the difference pretty much for the right one versus the left one. So in other words, the left one is the easy one to fix. All right, next condition we're seeing today is going to be selenium and magnesium deficiency, also known as grass tetany. Remember, also they call it white muscle disease as well. This condition, it is pretty much related with the time of the year. Springtime, that's when you're seeing the most. So usually happen on a female, adults, and pretty much they are focused on reproduction. The grass, it has a lot of potassium, and that start affecting the magnesium. Remember, there's always a correlation between potassium and magnesium. We've seen that one in our previous lectures about electrolyte classes. Um, anyway, so as I said before, we're gonna be seeing a little bit of clinical signs, stiff gait. We're gonna have a little bit of ataxia. The heart could be like even getting a heart failure because of the selenium. We can have recumbency, we can have paresthesia, we can be hypertonic, we can even have sudden death. Sudden death. So be aware of that. It can happen. It can happen a lot. So be aware of that. That's pretty much something important. Magnesium is always a big thing. Um, Selenium, basically the white muscle disease. You're gonna see it right there under necropsy. That's when you'll find out about the poor coloring on the muscle. So differential diagnosis with selenium toxicity, we have spinal injury or any kind of cardiomyopathy, right? For what we're seeing already with the heart. And then magnesium, usual differential diagnosis for magnesium is going to be low calcium because typically can show you this kind of like neurological diseases like milk fever, rabies, meningitis, polio, trauma. Any of those could be also looking pretty similar to magnesium deficiency. So in the case of selenium, the treatment it will be a selenium 0.05 parts per million in blood work. If we start noticing that and the CPK going up, that's a possible myopathy. So be aware of that. That's pretty much our diagnostic. 0.05 parts per million in blood work. Injection of selenium with vitamin E. They always come together. They're always given together. About 2.5 to 3.7 milliliters for every 100 pounds, SUQ or IM. In prognosis on selenium, white muscle is fair to good, depending where are you cutting it, right? But there's something available. There's selenium with vitamin E, and you can give it injectable, so shouldn't be a big deal if you cut it on time. Always just check for the stiff gait, ataxia, heart failure. Of course, it doesn't get complicated with the heart. Should be better prognosis. If not, it's going to be poor prognosis. For magnesium deficiency, we're going to give him magnesium borogluconate and IV injection, distilled with water, or we can do magnesium sulfate SUQ. Will you have the chance to do IV or SUQ on the magnesium? Now the recovery on this one, it will be a little bit fair to poor. So this is going to be a little more challenging to treat, mostly because of the dearrangements that we are seeing already on the muscles, and the main muscle on your body is always going to be your heart. And the problem is that your potassium is going up, and you have to find out if your potassium is already dearranged and other electrolytes. So you have to act quickly. Hopefully they'll recover, but prognosis in general is fair to poor with the magnesium deficiency. All right, well, that's for pretty much this type of diseases that we're having for exploitation of the cows and poor grass. All right, this is one of my favorite ones. Trimericular peritonitis, TRP. So usually happen anywhere about 60 days of age, affecting the rumen because that's when the rumen start developing. Um, Other name is called hardware disease too, right? Or used to be called hardware disease. So on the TRP, we're gonna be seeing things like anorexia, stop eating, agalactia, no producing any type of milk. Uh, they don't want it to move. They don't want it to lay. It's kind of like being paralyzed. It's like you got something in yourself. You have a wire. You got something lodged in yourself. You don't want to even move because you know if you do the weird movement, something is gonna happen. So be aware of that. Uh, Mostly the cows they're gonna have like a little bit of arch back too, and once again it's because of the same thing, and they're gonna be groaning too, and mostly while they're racing, right, trying to move up or trying to move up. So one of the consequences that we can have with this type of disease because of the same thing, either because of the cow is paralyzed or becoming so much distension inside, it's vagal indigestion. So vagal indigestion, it could be secondary to TRP. So if you start seeing a cow that is not really wanting to move, it looks painful, and it's not eating, and then also you have vagal indigestion on top of that, don't just go for the vagal indigestion right away. And just consider that vagal indigestion is because there's something behind it, and that something it could be TRP. So usually vagal indigestion happens when we are perforating the reticulum and gets all the way to the vagal nerve receptors. So that's when there's a problem right there inside your cow. And if we end up having this vagal indigestion, we're gonna have this pretty common um, pathognomonic sign of the papal shape. We're gonna have a shape of an apple on the left side of your cow, and it's gonna look like a pear on your right side of your cow. So this is called the papal, right, or the apple pear, or upper. That's another one calling it the upper. Another one calling the upper. There's another one calling the papal. But anyway, whatever is where you're seeing it, you're seeing from the right to the left or the left to the right. If you're seeing it from the right to the left, it will be the papal, no? Because the right one is going to be like a pear, and the left one is going to be like an apple. But if you're seeing the cow from the other way, it will be the upper, the upper. So that's another way to say it. You always can do your Withers test on the cow. Go over there and pinch it. Try to see electrically the cow is going to be going down. Is it reluctant to move, groaning? Most likely something is going on inside. So another thing that is pretty common with vagal indigestion, it is feces. They're going to be different. You know, feces on the cow usually are like all smeary and liquidy most of the time. Not really liquidy, but smeary. At this time, it's gonna be like almost like a horse feces, all dry, the pieces of horse. And you don't have a horse, you have a cow. So be aware of that. You can do a rebound test. Start punching your cow a little bit, like practicing a little bit of Rocky Balboa exercises. But if you're reluctant and painful, you know that you're dealing with something else inside. Differential diagnostics, we have pyelonephritis, gastrointestinal ulcers, or ruptured uterus. Any of those can happen, so be aware of that. We can always do an abdominal synthesis for diagnostics, just to find out if there's fluid over there, we have peritonitis going or not. It's a possibility, be sure of that. Treatment, we have to decide medical versus surgical. Medical, if we have something that is on the vicinity inside the organs and we're not perforating, we can still using the magnet. We can give some antibiotics. We can give some anti-inflammatories. In this case, for cows, we use meloxicam, and we can use something else to help with alkalosis laxatives. And if we need surgery, then we're talking about ruminotomy. And most of the time, after doing the procedure of the paralumbar fossa, we're going to be placing our magnets. Remember, we have to do all our paralumbar blockage, right? Cranial, caudal, and to finish all those together. So be sure that you don't have any possibility of wires in your farm. Always check for that. Be sure that you're not using any of those hell bays that they have like comes with a wire wrap around, because certainly that can be a factor with these cows. They like to eat everything, and eating a piece of wire for them, they're nothing. Typically, we're talking about wires that they're like 4 inches or longer. So 4 inches is a good number. It's almost 15 centimeters, but one of those can cause a TRP in a cow and can cause their death for sure. So be aware of that. Be proactive. Do not use those type of things and keep it away from trouble. Thank you. All right, all right. So next condition we have here today is ketosis. So ketosis, once again, exploitation of the cow. Poor cows. All right, ketosis of the cow. As we talked before, ketosis on the dairy cow is just another cow exploitation disease. Poor animals, really. They just suffer so much. It's all our fault. Anyway, so we start having this one on 10% of our cows or more, then we need to start looking into the management of diet on this cow. So pretty much happening a lot on dairy cows, usually post parturition, 1 week before a week, sorry, after parturition, all the way to a month after parturition. So kind of like the other exploiting disease that we've seen them before. Um, so clinical signs, pica, the posture, um, the breath of the cow, their breath is going to be all ketotic. It's going to smell. We're going to have ketonuria. So be aware of those things. Um, Differential diagnostic with ketosis, rabies, pseudorabies, mange, ringworm, just because of the pica and the posture and the scratching, paresthesia. So many things going on. Remember, with ketosis, we have three types of ketosis: type 1, type 2, and type 3. Pretty classic. Type 1, we're going to sit on the thin cow. It's pretty much the thinner cow. 14 to 50 days post parturition, that's what we're going to be seeing it. And usually because there's a high lactational demand, so it's pretty expected. And usually on this type and type 1, we can start reducing the protein intake in, and then I start giving a little more carbohydrates. And because typically we have uh, some productions that we're giving them more than 19% of the protein. If the cow is ketotic on type 1, we can start giving dextrose IV, a little bit of corticosteroids, and maybe propylene glycol mixed together with this. For type 2, usually happen anywhere between 0 to 2 weeks postpartum. This is the most common one for the fat cow. I mean, the most of the cows are fat. Obese, they're going to have insulin resistant, hepatic lipidosis. They're going to look more neurological. The mortality could be high on this one, the type 2. So we need to start doing force feeding or transhumination on these cows. Transhumination is something that we can do all the time in between cows. And if we're doing something IV, of course, dextrose and insulin to help with high potassium. Insulin, we can give it up to 200 units daily per cow, and dextrose, a 5% solution. Type 3 is mostly the one that is related with butyric acid. That's related with the silage butyric acid, because we had the beta hydroxybutyrate in there. And we need to check the blood BHB, or blood beta hydroxybutyrate. And if we start seeing more than 14.4 milligrams per milliliter, it's a positive. It is a positive. So we need to start treating it. When we're checking the dipstick, be sure that we're checking for ketonuria, right? Which is important. And we can do always a sample in the herd. In order to sample the herd, we can check anywhere between 12 to 15 cows out of your 100. And if we're having anywhere between like a 10% out of those, which will be like 2 or 3 cows coming positive, we have a problem. So that's when we have to start looking more